We now know that if you maintain healthy teeth, you have improved cardiovascular health, you have a reduced risk of diabetes, and also improved cognitive function as we age. So in short, taking care of your teeth, maintaining healthy teeth is more than about cosmetics or comfort. It's really an investment in your long-term health and well-being.
Hey everyone, this is Jonathan Marks from GoToHealth. I hope you're having a great day. We've got an important topic, as always. I always say that, but it's true. Tooth pain is often dismissed or treated too late, but many patients don't realize there's a dental specialist uniquely qualified to diagnose and treat the most common causes of tooth pain, infection, and inflammation. That expert is the endodontist. Endodontists are dentists with 2 to 3 additional years of advanced specialty training focused on the inside of the tooth, the nerve, the roots, and surrounding tissues. While best known for root canals, endodontists do far more. They specialize in saving natural teeth, relieving pain, and helping patients avoid unnecessary extractions and more invasive procedures. And in addition to keeping teeth healthy, a newly published study suggests that successfully treating tooth infection and inflammation may support broader health benefits, including improvements in markers related to blood sugar and cholesterol, reducing both the risk of diabetes and heart disease. While research continues, one message is clear. Oral health is deeply connected to whole body health, and delaying care can have consequences. With us to talk about this today is Dr. Stephen Katz, the president of the American Association of Endodontists. He's a diplomate of the American Board of Endodontists, a member of the American Dental Association, and is in full-time practice in Beachwood, Ohio, and an adjunct assistant professor at West Virginia University School of Dentistry. And if you want to learn more about all this, and I recommend you do, visit the website findmyendodontist.com. Before we get to Dr. Katz, a reminder, visit our website and subscribe at gotohealthmedia.com. If you like our show, give us a thumbs up or a 5-star review on Apple, Spotify, or YouTube. It helps us get the word out to more people. Thank you in advance. So welcome to the show, Dr. Stephen Katz. How are you today?
I am great. Thank you for having me.
Good. So tell us, what exactly is an endodontist and how are they different from a general dentist?
An endodontist is a dentist, but we have 2 to 3 years of additional education and training. Our training is focused on the inside of the tooth. So the nervous tissue, the roots, and the surrounding structures. You typically would know us as the root canal specialists.
Yes.
But endodontists are really much more than that. We are the tooth saving specialists. So we take care of patients that are in pain. We help patients avoid unnecessary extractions and costly additional procedures that they otherwise wouldn't need.
Good for you. So when should a patient see an endodontist? Do I find one myself or do I get recommended by my dentist? How does this work?
Of course. So a patient should see an endodontist if they have pain, if they have swelling, sensitivity to hot or cold, if they've broken a tooth, or if they've had a dental trauma. But remember, there's no amount of pain or swelling in your mouth that should be considered normal. So you have 2 options. You can reach out to your own dentist. You can ask for a referral to an endodontist, or you could go to findmyendodontist.com and you could find an endodontist in your local area.
Good. So let me ask about root canals since you brought that up. Is that really painful or is that a myth?
Well, right now, that is one of the biggest myths in all of dentistry. Root canal procedures are not painful. Root canal procedures are not any different than having a routine filling done at your general dentist's office. We have new techniques, new technologies, better, improved local anesthetics. The process, the procedure is quick, it's easy, it's comfortable, it's pain-free. our patients frequently report to us after the procedure how easy the whole process was. So I would tell you, don't be afraid of having a root canal. It will not be uncomfortable. We like to say, this is not your grandmother's root canal.
Good. I'm glad to hear that. So let me ask about that. A root canal is really saving your tooth. Why is saving your natural tooth better than removing it?
Well, you're correct. A root canal is all about saving your natural teeth. And that is so very important. First of all, nothing looks, functions, or feels like our natural teeth. We need them for speaking, for chewing, and our all-important smiles. But it's really much more than that. We now know that if you maintain healthy teeth, you have improved cardiovascular health, you have a reduced risk of diabetes, and also improved cognitive function as we age. So in short, taking care of your teeth, maintaining healthy teeth is more than about cosmetics or comfort. It's really an investment in your long-term health and well-being.
I'd like you to go into a little bit more detail about what you just said, doctor, because I think most of us just think of our mouths as just our mouths. How's it really connected to the rest of the body? But you're talking about cardiovascular health, mental health, diabetes. What's the connection between our mouths and the rest of our body and our health?
Well, the connection really is inflammation. There is still lots of research going on, but we now know that our oral health is really very closely connected to our overall health. So I'll give you an example. There's a recent study that came out of a hospital in London where they showed that patients that had infections, if they were treated by root canal therapy, that their markers for cholesterol and for blood sugar improved. So what does that mean? That means that they have less risk for cardiovascular disease and developing diabetes. Now, again, there's lots more research that needs to be done. We're in the very earliest of stages, but that connection has become so obvious.
Thank you for that. It's really eye-opening, and I hope people are listening to this lesson here. So I'm going to ask a question, but I think you've answered it already, which is, how does an untreated tooth or an infection affect our overall health? If you can just repeat that for us so we get that into our thick heads.
Well, again, yeah, I think based on this new research, we know about how closely connected oral and systemic health are. But what we're finding is that patients that are delaying treatment because of the inflammation that occurs, it can affect their overall health. So the message here is, don't delay treatment. Go see your endodontist. The sooner the better. We'll take care of it, and we'll do it pain-free.
Great. And mention that website one more time.
The website is findmyendodontist.com. There's lots of great information on there about saving teeth, or you can also find an endodontist in your neighborhood on that website.
And a final question, do I find my own endodontist, or should I really be getting a recommendation from my dentist?
Well, you can ask your dentist if you have questions, or you can find your own endodontist by going to that website. So you don't have to go to an endodontist through your own dentist. Okay. You can do it by yourself.
Good. So is there any question I didn't ask that I should have, or what kind of big message would you like to leave with people today, doctor?
I think the message is a couple-fold. Number one, oral health is connected to overall health, so take care of your teeth. Number two, nothing functions, feels, or looks like our natural teeth. And number three is, don't fear the endodontist. We'll make sure the procedure is comfortable for you. We'll take good care of you. Take care of your teeth. Save your natural teeth.
Good. Thanks so much for being with us today and sharing this important message. I've learned a lot.
Great. Thank you for having me, Jonathan.
It's been a pleasure. We've been speaking with Dr. Stephen Katz. He's the president of the American Association of Endodontists. He's a diplomate of the American Board of Endodontists and a member of the American Dental Association. He's in full-time private practice in Beachwood, Ohio, and an adjunct assistant professor at West Virginia University School of Dentistry. Thanks again for being with us, Doctor.
Thanks for having me.
My pleasure. This has been Jonathan Marks with GoToHealth. If you want to learn more about us, please visit our website at gotohealthmedia.com, where you can see all our shows. And if you're liking our shows, please give us a thumbs up or a 5-star review on Apple, Spotify, YouTube, or wherever you're finding us. It helps us get the word out to more people. This has been Jonathan Marks with GoToHealth. And as we say at the end of every show, go to health. God bless. We'll see you again next time. Bye-bye.
Thank you. Appreciate it.
Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.